Freeman Hospital in Joplin is making sure its workers and area first responders are prepared for the possibility of an active shooter situation. You got to do it these days. KOAM's Yana Tala was at the workshop, and Yana has more.
With the recent mass shootings, Freeman Health System is being proactive for critical situations like that.
It's not if it's going to happen, it's when it's going to happen. We haven't had a large active shooter here. It will happen.
On Tuesday, Freeman held their first pediatric and active shooter and trauma workshop. The event had attendees from the local state and emergency management, local healthcare providers, and other law enforcement agencies.
We want to do some pre-planning with all the possible people to be involved in an active shooter situation, get them in one room to start our planning process.
The goal for the day was not to immediately come up with a plan, but for people to get to know each other and work well together in a critical situation.
Right now I'm trying to reach out to these groups and let's try to standardize our approach as much as possible. So when things happen, we're all on the same page. What we saw happen in Texas, there were 376 law enforcement officers there. Came from multiple agencies. EMS was there. They didn't know how to work together. They didn't know who was in charge at the scene. And we can't wait till we have children that have been shot to work out those details.
Captain Trevor Duncan thinks it's crucial to be familiar with the different agencies and their workers when a critical situation happens.
As law enforcement and multiple other agencies, it's our role to be prepared for that. And by creating a partnership with different businesses and agencies and hospitals and things like that, we're all more prepared for it. We're all more ready to respond.
Reporting from Joplin, Yana Hautala, KOAM News.